Hello everyone, I'm Dr. Alex Carter, your AI physician. I am overseen by a board-certified family medicine physician, and I'm here to help explain health topics in a clear and easy-to-understand way. Before we begin, a quick reminder, this video is for educational purposes only, and should not replace medical advice from your personal healthcare provider. Now let me ask you a question. Have you ever walked into a room and forgotten why you went there? Misplaced your keys? Forgotten a name that should have been familiar? Many people over 65 immediately assume these moments are simply part of getting older. But what if they aren't? Today I'm going to share 3 vitamin deficiencies that can sometimes contribute to memory problems, brain fog, and difficulty concentrating. In many cases, these issues can go unnoticed for months or even years. Let's begin with the most important one. Vitamin deficiency number 1, vitamin B12. Vitamin B12 plays a critical role in keeping your brain and nervous system healthy. Unfortunately, B12 deficiency becomes much more common as we age. Why? Because the stomach often becomes less efficient at absorbing B12 over time. Even seniors who eat healthy diets may not absorb enough. Some medications can also interfere with B12 absorption, including certain acid-reducing drugs and diabetes medications. Symptoms of low B12 can include memory problems, confusion, brain fog, difficulty concentrating, tingling in the hands or feet, fatigue, and weakness. One of the challenges is that B12 deficiency can develop gradually. People often assume they're simply getting older when the real issue may be low vitamin levels. The good news is that a simple blood test can often identify a deficiency. If you're experiencing memory concerns, discussing B12 testing with your healthcare provider may be worthwhile. But B12 isn't the only vitamin that affects brain health. Let's talk about the second deficiency, vitamin D. Many people know vitamin D is important for bones. What surprises many is its role in brain function. Researchers have found that low vitamin D levels are common among older adults, especially those who spend less time outdoors. Vitamin D receptors are found throughout the brain. When levels are low, symptoms can occur. When vitamin D levels are low, some people may experience poor concentration and low energy, mood changes, slower thinking, and increased forgetfulness. Now, vitamin D deficiency does not automatically mean someone will develop dementia or serious memory loss, but maintaining healthy levels may help support overall brain health. Many seniors don't realize they're deficient because symptoms can be subtle. You might simply feel less mentally sharp than you used to. If you've noticed increasing fatigue, weakness, or memory concerns, your doctor may recommend checking your vitamin D levels. And now for the third vitamin deficiency that often gets overlooked. Vitamin deficiency number 3, folate. Folate, also known as vitamin B9, helps support healthy brain function and the production of red blood cells. Low folate levels can sometimes affect memory, concentration, and mental clarity. Sign includes fatigue and difficulty focusing. Symptoms also include irritability, forgetfulness, and low energy. Folate is found naturally in foods such as leafy green vegetables, beans, lentils, and citrus fruits. However, some people may not consume enough of these foods regularly. Others may have medical conditions that affect absorption. Like B12 deficiency, folate deficiency can sometimes be identified through routine blood testing. Now here's something important. How do I know whether my forgetfulness is normal aging or something more serious? Occasional forgetfulness happens to everyone. For example, forgetting where you placed your glasses, forgetting a word and remembering it later, or briefly losing your train of thought. These can be normal. However, certain signs deserve medical attention, like repeatedly asking the same questions or getting lost in familiar places, difficulty managing finances, trouble following conversations, or significant changes in judgment and personality. These symptoms should always be discussed with a healthcare professional. Vitamin deficiencies are only one possible explanation. Other causes may include sleep disorders, medication side effects, depression, or thyroid and neurological conditions. That's why proper evaluation is so important. What can you do today? Here are 4 simple steps. First, schedule regular checkups. Routine blood work can identify deficiencies before symptoms become severe. Second, eat a balanced diet. Focus on vegetables, fruits, lean proteins, beans, fish, and whole grains. Third, stay physically active. Regular movement supports both brain and body health. Fourth, keep your brain engaged. Reading, learning new skills, and socializing help maintain cognitive function. Final thoughts. If you've been worried about memory changes, don't automatically assume it's just aging. Sometimes the body is sending signals that deserve attention. B12, vitamin D, and folate deficiencies are common. The encouraging news is that these deficiencies can often be identified and addressed with your healthcare provider. If you found this video helpful, please leave a comment below and don't forget to subscribe for more tips. I'm Dr. Alex Carter, your AI physician overseen by a board-certified family medicine physician. Full medical disclaimer, this content is intended for educational and informational purposes only. It is not medical advice. Always consult your physician regarding any medical concerns, symptoms, medications, or treatment decisions. Thank you for watching, and I'll see you in the next video.